Oh, hey, Tasha, you made it. How's it going?
Good, how are you?
I am doing well, doing well. Thank you for coming out this morning.
Yeah, of course.
Yeah, it's early here, but we're surviving. We actually just got through our first half hour of getting everyone set up here. But the conference has been going well so far. We have several thousand people taking classes right now, so it's pretty cool. Yeah, and it should be a fun day.
That's exciting. I'm happy to join today.
Yeah, so I wanted to ask you. I'll put up on the screen so everyone can see it here, just real briefly, our schedule, because I mentioned before I actually had to deal with all these troubleshooting problems that we had. I'll put up the schedule again so people can see what I'm talking about. Um, Pop it up here on the screen. So neurotrophic keratitis is a topic that's actually in our first hour that's being covered right now. There's a lecture that's actually happening as we speak. And this was a disease that I think a lot of folks weren't necessarily familiar with, right? Up until very recently, they might have thought their patients just had a dry eye. They might have sort of slipped under the radar. Now, of course, people are becoming much more aware of the disease. Obviously, Oxervate is out there that people can use. But what I wanted to talk
Mhm.
to you about today was not sort of the clinical stuff, right? Because Clark Chang and Melissa are probably driving that into the ground in their lecture right now. Um,
Yep.
but more of sort of the access. Access to meds is it's a huge issue, right? And being able to actually get the products that you need to treat patients is important. In fact, it's funny. Before we came on here, I was refreshing my health department in my state for the COVID-19 vaccine, right? Talk about access, right? This is a
Yep.
big thing that's been on everyone's mind, right? So, but I wanted to talk to you a little bit today, sort of about access, and I know this is what you're all about with your position at Dompe. So maybe you could tell us a little bit about yourself and what you do there.
Yeah. I live and breathe access. My whole career has been in access. I started kind of from the bottom, working at reimbursement like hubs. I started by talking to patients, talking to physicians, verifying insurance benefits, doing prior authorizations, processing patient assistance applications, and copay cards. From there, I kind of worked my way up managing those operational hubs, and then working with manufacturers on the vendor side to manage those hubs and facilitate those hubs. And then eventually I made my way over to the manufacturer side, to my position here at Dompe. So at Dompe, I do lead the market access strategy and the market access team here. And our team consists of about 10 individuals that include our patient access managers. So our patient access managers do work alongside of our key account managers to help support our customers and our patients, on the access front. So I lead the strategy, and our patient access managers help support our customers from an access perspective.
Got it. And so, we mentioned the word access before. I was mentioning it in the context of COVID, right? So this is like literally,
Mhm.
where do I go to get it? But what does access mean to you, for your position at Dompe and with Oxervate? What does that actually mean?
Yeah, that's a really great question. So access for me is ensuring that like our patients and our customers have the means to be able to get the product, and that it is affordable to them. So helping customers understand, that their patients have access to Oxervate, meaning that they're able to get the product, that their patient's insurance is covers it, and if it doesn't cover it, what are the other avenues that the patient have to obtain the medication? And from a patient perspective, kind of the same thing. So, from a patient understanding what their insurance coverage is for Oxervate, and then if they need any financial assistance, that they have the financial assistance they need to be able to obtain the treatment.
Right. And it's an interesting thing. Most physicians probably, NK is it's a relatively rare disease, so they may just be getting
Mhm.
started using something like Oxervate. So maybe you could step us through, they've made the clinical determination that this would be a useful treatment. How do they get the patient into that pipeline to get them what they need?
That is a very good question. We get this question very often. So for us, it's pretty easy. We have what's called Dompe Connected Care, which is a suite of services for our physicians or our customers. Through Dompe Connected Care, there's an enrollment form that you can find on our website. It's a pretty simple two-page form, and it does act as the prescription. Once you complete that enrollment form, you send it in, to our Dompe Connected Care service. From there, Dompe Connected Care is able to contact the patient's insurance provider verify the coverage for Oxervate. So they call the insurance plan, they determine what is the coverage. Is there a prior authorization that is required? If there is, they determine what are the steps that's needed for a physician office to complete that prior authorization. And then they relay that information to the office. They tell them exactly what's needed of the office to do. And then once you submit or the customer submits that prior authorization, Dompe Connect Care will continue to follow up on that and provide the office with that information. They'll let you know what's going on every step of the way. On top of that, they are in communication with the patient. They inform them, of the services as well. They do what's called a welcome call. They tell them about Dompe Connect Care, and they let them know kind of some expectations of what's going to be coming in terms of their Oxervate treatment. And once the prior authorization is approved, if the patient needs financial assistance, Dompe Connect Care will provide some options to the patient as far as financial assistance go, depending on what the patient's coverage is. And then from there, they facilitate delivery schedule for the treatment through Accredo, our specialty pharmacy. So Dompe Connect Care actually helps the patient facilitate scheduling that delivery through Accredo.
Wow.
So as long as the physician goes through Dompe Connect Care and fills out that enrollment form, it's pretty easy.
So you guys basically handle everything. So for the doctor, this is like a fairly send it off, and then you can handle all the insurance issues. I know one question that people have had in the past is, can you give us a sense of what insurers actually cover the medicine at this point? Or is it everybody or some? Or I know that you actually will go through the process of making sure that the patient's covered, but just in general, do most insurers cover it?
Yeah, in general, most insurances do cover Oxervate, whether it's commercial coverage or government-funded coverage. Most insurance do cover it. However, coverage does vary dependent on the patient's insurance coverage. But what Dompe Connect Care will do, again, is they're calling to verify what specifics are required for that patient. I do want to clarify, so Dompe Connect Care does a lot of the legwork for the offices, but the offices are going to have to do some work as well. So Dompe Connect Care will provide what's required of the office to submit that prior authorization, but the office will still have to submit it. But going back to your original question, most insurance companies do cover it. There's just sometimes some different requirements dependent on the prior authorization.
Got it. And in terms of sort of the turnaround time, from the time we fill out that little 2-page sheet, to the time the patient gets their meds, what's the typical, length of time in between?
Not to give you the same answer, but it does vary.
Sure.
Turnaround time does vary on a couple of different factors. So one is how quickly the office can complete that prior authorization. We know the offices are very busy with patients and sometimes are a little bit shorthanded, but how quickly you can get that prior authorization turned into the insurance company does help because it helps shorten that turnaround time. Another factor of the turnaround time is how long the insurance company takes to review that prior authorization. We have seen that be very quick, but it does depend on the insurance company. Another factor is the patient. In terms of getting financial assistance, that can depend on what type of financial assistance the patient needs. And then another factor is actually scheduling the shipment. Accredo does need to talk directly to the patient before they can schedule that shipment. And sometimes it takes a little bit longer to get a hold of that patient to actually schedule the shipment. So there's different stops along the way that could extend that turnaround time. But as long as the office is engaged and doing that prior authorization, and as long as the patient is engaged as well, that turnaround time can be fairly short. But for specialty medications, it's not like just going down your CVS pharmacy and picking it up the next day that you write that prescription. It does take a little bit of time, just depending on all those different factors. So keep that in mind when you're, treating your patients with Oxervate.
Got it. And one other question that I know people have is, it sounds like there are multiple parties that are going to be touching this data and looking at it and so on and so forth as the patient goes through the process. Can you speak a little bit to sort of HIPAA and how that all works, and where this data is going, and is the patient data actually protected at each step?
Yes, it absolutely is. So through Dompe Connect Care and through Accredo, both entities are HIPAA compliant. So the patient's data is always protected, no matter who's touching it.
Excellent. So patients don't have to worry about that.
Mm.
Great. So I guess one other question, since NK is kind of a new disease to a lot of us, we're just learning about it now and the different treatment options. Have you guys actually put together anything to sort of help, educate folks? I mean, obviously, education is what we're about here, right? We're doing that lecture right now as we speak with Clark Chang and Melissa Barnett. But on your end, do you have any materials that you could give to both the doctors and the patients maybe to help them educate them on the disease?
Yes, yes. So there's many different materials for both the providers and the patients. So your key account managers can provide materials to the physicians. There's also our website, which has a plethora of information around the disease state and around Oxervate. And then from a patient perspective, through Dompe Connect Care, we send out a welcome kit that includes a patient brochure that talks a lot about the disease state and Oxervate. So there's many different avenues and resources that both a physician and a patient can go to obtain information about NK and about Oxervate, as well as Dompe Connect Care.
Yep, and I'm actually putting up on the screen right now so people can see the Oxervate website. And I stumbled across another one. No NK. This has got to be yours,
Yes,
right?
it is. Yes. So that is ours as well.
Yep.
And that is a great resource for a disease state perspective.
Yeah. So, because that was when I was searching, I'm like, oh, okay, so that's interesting. So, and it actually gives really good. It gives information that's actually useful at the level of both the patient and the doctor. And I'll show it to people later. That one with touching the patient's eye. With a Q-tip, right? So, it's something very sort of, as I was looking at it, it was funny. My son walked in the room. He's 11 years old, and he's like, you wouldn't really do that to someone, would you? I'm like, well,
technically.
yeah. But yeah, so no, it's a great resource. And I mean, it's really well done. So I think everyone should take a look at it. And throughout the day today, we'll be bringing up the website to show it to people as well.
Yeah, and on the website, one thing to note is we have a great administration video. One thing about Oxervate is it's not just your typical eye drop. It's not just in a regular dropper bottle. And so our administration video is a great resource for physicians to get a sense of what is expected of Oxervate when a patient receives it and how to administer it. And it's also a great resource for patients. So through Credo and through Dompe Connect Care, we encourage patients to watch the administration video. We also encourage physicians to show this administration video to patients while they're in the office. So it helps set the expectation for the patient on what the treatment is going to be like for them and what they're going to receive on their door when it's delivered to them.
Excellent. And you can actually see it right here. There's the video right here. You just go to dosing and administration at Oxervate.com. So fantastic. Well, Tasha, thank you so much for doing this today. It's been really great. We're going to replay this over and over for people to see it during our live stream this week. And I'm sure as questions come in, I will forward them on to you because there will be many, and maybe we can even come back here next time around for the next CEwire and in April and review it then.
Yeah, I'm happy to join at any time, and please send your questions my way. I'm always happy to answer.
All right. Thanks again.
Thank you so much. Have a great day.
You too.